Hi, Seth Bilazarian on a brief word on peripheral arterial disease, or PAD. Peripheral arterial disease is called peripheral because it's not central to our torso, where our heart is and our vital organs. It involves the arteries going to our legs. So peripheral arterial disease is an arterial process that involves plaquing and narrowing the arteries, similar to what might happen with heart attacks or strokes. But what happens when we narrow the arteries to our legs is pain develops with walking. This pain is called claudication, and it usually involves a tightness or a heaviness or a fatigue or frank pain in the calf muscle in the back of the leg below the knee that happens when someone walks a certain distance. So claudication, we sometimes say, happens at 1 block or 2 blocks, or for those of us who don't live in cities with blocks, at 50 yards or 100 yards. The patient has to stop and rest and then can resume walking after a period of time. What's happening in this circumstance is that the blood flow is restricted to that muscle, so every time we walk, we push off with our muscle. The muscle requires oxygen. There's not enough oxygen, and the muscle is suffering, and that's what we're told about. The evaluation for this is very simple. We do basic non-invasive testing called an ankle brachial index, or ABI, which is a measurement of pressure at the ankles, and ultrasound testing to evaluate the severity of the blockage. If we identify a blockage, there's often a minimally invasive option like stent placement, and I'm holding a stent here. This is a stent that would be put in the artery going to the leg that would then allow improved blood flow. Of course, all patients who have this problem, we vigorously try to have them stop developing these plaques. And the number 1 cause of this is smoking, and the number 2 cause of this is diabetes, so smoking and diabetes. We want all of their good risk factors like cholesterol and blood pressure, of course, to be in line, but those are the 2 biggest issues, diabetes and smoking. So the approach to patients with peripheral arterial disease is first to evaluate the problem with non-invasive testing, aggressively pursue risk factors, encourage walking because that can encourage improved circulation, but ultimately many patients need a stent type procedure. This is Seth Bilazarian again. Thanks for joining me for PAD, or peripheral arterial disease. Please see our other resources on the website.